One cares for patients with heart pumps, one guides patients involved in clinical trials, and this one has grown her career into coordinating an entire program. On today's All Things Heart, what these highly specialized nurses have in common. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. May is Nurses Appreciation Month, and today we're celebrating three amazing nurses who've taken their careers in vastly different directions. All of them work in cardiology, and when it comes to how our patients feel about the nurses here who care for them, the feelings are quite similar.
I just would say thank you. The care. They were just like your friends.
They're amazing.
They're not just going through the motion, you know, and I don't feel like a number.
I mean, it was like your family taking care of you. It was it was very, very amazing. Mm-hmm. It was hard to leave when I had to because I had so many people around me that just took care of me.
They know about my dog, they know about my family, they know about my travels, so it's not just them being my nurse, it's them also being kind of like a friend in a way. So, I mean, if you see them outside of the hospital, you're going to be like, oh my gosh, like, hey, how are you?
The team here, the nurses that come out that I've met, this is a good staff here. You know, they make you feel like you're at home, you know. It's like, kind of like family. You become family, you know. We laugh, we joke. We reminisce, we talk about a little bit of everything, you know.
I mean, you can have your family and friends, but they don't know anything about cardiac issues, so having just the nurses and know that they're knowledgeable enough to be able to share what is best for you.
It's just nice that they love what they do, and Ashley loves what she does. So I'm glad that she's my nurse.
Such nice things, and everyone says you feel like family to them, family that has medical background and expertise, which is always a plus. That's so nice. We are thrilled to welcome our four incredible nurses. We have Diana Stanley. Diana is the Adult Congenital Heart Disease Program Coordinator. Ashley Manning is an LVAD coordinator here at the health system, and Sophia Rule is a clinical research nurse for cardiology. Thank you all for taking the time to join us today. We know you have super busy schedules. We are so happy to be able to highlight these different nursing careers on All Things Heart. So Diana, I want to start with you. Nursing is in your blood. Yeah. How did you start? How did you get this passion to be a nurse?
So my mom is a nurse, and then I've got 3 or 4 aunts that are also nurses. So it's kind of what I've seen my whole life. So I remember at a young age in high school, I actually said I wanted to be a nurse, and my mom said, well, we'll see. And she had me take a CNA class actually in high school, and I worked in a nursing home, and which was great. When I went to college, it was great. I feel like I was kind of ahead of some of my classmates because I knew a little bit and I'd seen some things, heard some things, but yeah, it's in my blood, so.
You followed in the footsteps of your family. Are they so proud of you?
Yeah.
I bet that's cool.
So, yeah. It's still hard. You know, sometimes my mom and I'll talk and she's like, you know, and I'm like, Mom, remember, I am a nurse too.
Oh, she's trying to, she's trying to do the medical thing too on you. Right. Yeah. That's hard. Sophia, you work on the research side, which is fascinating with patients in clinical trials. What drew you to working with patients in clinical trials?
Yeah, I feel like, you know, research is like super interesting. There's always like new advancements in science and medicine. And I just think I've heard research, you know, as a new grad, I was hearing that research was offering all these like alternative treatments, and I thought that would be really cool to give patients like a different alternative if, you know, medications that they were on just weren't really helping their symptoms. So it's a really good opportunity for other patients.
And we've had you on the program talking about how you help get patients to qualify for these clinical trials. We're going to get to that in just a moment. Ashley, you work with LVAD patients. LVAD patients are a very specific group. How did you realize that you wanted to work with patients who have LVADs?
Yeah, I think, you know, I worked on the 4th floor in the heart center taking care of them after surgery, and just seeing that progression from being just so sick to getting to have like a second chance at life was just really great. And, you know, working on the outpatient side like I do now, I get to like get to know patients like John and, see patients that were really like kind of on the palliative route or hospice route, and then now they get to live and travel and, be with their family. It's just really special thing to be a part of.
You were taking care of patients in their roughest moments, and now you're taking care of patients once they have this second chance, which would be fulfilling, I would imagine.
Yeah.
Diana, did you always know that you wanted to work with cardiology patients or in cardiology?
So yes and no. In school, there were two things I liked the best, and one was oncology and one was cardiology, both kind of two different continuums. When I graduated from school, my husband and I moved to Minnesota, and I got job offers on both units as a new grad. And I came home and he goes, please don't do oncology, you get too attached. So I did cardiology. I like the fast pace, I like learning new things. I feel like it's kind of cutting edge, similar to oncology and how it can be. But yeah, there's such a passion for it. It's funny, I've done a little bit outside of cardiology, and every time I do, I'm like having to Google, now what is that? And that sounds crazy, but cardiology just came very easy to me versus some of the other specialties, yeah.
Somehow it clicked.
Yeah.
So as your role, in your role as coordinator, day to day, what is your most specific role now, coordinating the whole program?
Yeah, so I think coordination is really cool. My past life, I actually was a nurse manager after I was a bedside nurse. And when I looked at that role, what did I like the best? I liked making things better. I really liked, how do I make things better for the patients and the nurses or the caregivers that are at the bedside? And so that's what I look at every day in my role. So one of the things we're working on here is an accreditation for adult congenital heart disease. And so that's making things better, standardizing processes, developing education for not only the patients but also the staff, because adult congenital heart disease can be very complicated, and how do we help them learn? So it's really kind of, I say it's putting out fires some days, but it's fun putting out fires because in the long run we're making things better.
And you're used to putting out fires as a bedside nurse, which was your first life.
Yep.
So you can do that quite well. Ashley, I have a question for you as an LVAD coordinator. What has been the most challenging part of your job?
Probably because it is so specialized, and we're the only LVAD center in the state of Kansas, and I think sometimes, especially like if our patients need to have procedures, for example, other specialties can get a little nervous about the patients because they'll see, well, their echo says their EF is 10, which with that an LVAD would be very scary. So I think sometimes just having to provide that reassurance to these specialties, because we go into the procedures too. So anytime one of our patients has a procedure, like we're in there to monitor the device. So just making sure that everyone knows, like, hey, I'm here. I'll let you know if there's anything wrong, provide that reassurance. And
I bet that's reassuring, because I would like that if I was going into a procedure and the nurse who'd been my right-hand gal, like you're their friend too. If she told me or he told me they were going to be in the room, I would really like that.
Yeah, so it's good. The patients, feel comfortable. The anesthesia docs, the surgeons feel comfortable. Everyone's always excited to see the LVAD nurse come in. So, that's always good that we just get to collaborate and help take care of the patient.
We also had the pleasure, as you saw at the top of the program, of talking to some patients and doctors. And Sophia, we recently had you on one of our shows with a patient that you helped through a clinical trial. He said that you were crucial in his recovery, but you were also crucial in keeping him hopeful while he tried to qualify for so long for this trial. At any given time, how many participants are you working on giving that support to?
Yeah, so our research team, we're really robust. We have, 60 plus clinical trials, and each of those studies have anywhere from, 0 patients, we're still trying to find patients for the study, anywhere from 0 to like 100 patients, so it just kind of depends on the study. And then between myself and my teammates, we try to manage all of those patients, like their follow-ups, their screening, imaging, so day to day it looks a little different. And there's like different numbers of patients that you're taking care of and seeing each week. So,
and
yeah.
Does each patient get one clinical trial nurse that guides them, or is there a team guiding each patient?
Usually there's about 1 or 2 nurses that will help guide the patient. So, and really it's super collaborative. So everyone is kind of chiming in, I'll go run a lab for you. I'll go spin this tube for you. I'll go you know, chat with the patient and get them to sign the consent form. So there's a huge like collaborative effort. Yeah.
Now to the doctors, because we got a chance to talk to the doctors that work very closely with each of you. It was such a pleasure. And Diana, you coordinate the entire adult congenital heart disease program. So you work like this with Dr. J.D. Surface. We asked Dr. Surface what he'd do without you. He didn't even like to think about that.
Not much, at least not very well. Let's put it that way. So, like I said, our program is really has grown in leaps and bounds, both in terms of size, but also in terms of efficiency. And we are now much better able to keep track of our data and know how we're doing. You know, are we missing patients? Are patients being lost to follow-up? Are we actually doing all the things for those patients that we're supposed to be doing? And she is not only making sure that that happens, but she's developing systems and protocols that we can now implement that will automate that process moving forward, just to make our program all the more effective. And it's really worked wonders in a relatively short time span.
Diana, your career as a bedside nurse leading up to this new career, this new role in your career, how did that help you prepare and develop those unique skills for establishing new protocols?
So I think I said, you know, earlier, I was a nurse manager in a previous life, and the things I liked was making things better. But when I was a bedside nurse, I was kind of the same way.
And a nurse manager, just for our viewers who aren't familiar, what does a nurse manager do?
Yeah, so I managed a staff of about 90 individuals on a cardiothoracic step-down unit for about a 10-year period of my life. And it's a hard, demanding job, but it's a great job. It's very rewarding. You know, I still love the staff I managed. I talk to many of them to this day, and we have great memories and laughs. But again, making things better was the piece that I've always liked. I loved education when I was a bedside nurse, so that was one of the things I focused on a lot, was educating them. There was always a need for that, and I think especially in cardiology, it's important to know how to prevent things from happening, what to do to make things better, who to call if you need help, all of those things. So, you know, in the video clip that you saw, I was actually educating Addison, utilizing a new education plan that we developed with Dr. Surface and with our nurses to help, you know, the patients all know what they needed. And I think the biggest takeaway, I've actually had the opportunity to educate patients on the inpatient side as well, is that phone number of how to get a hold of us if you need something. And so it's fun. It's fun to see the evolution of a program and make sure we're taking care of our patients like we would want to be taken care of, or our family members would want to be taken care of. So, yeah.
And in really any field, it's always better, I think, to have a boss that's done what you have, someone above you that's already done your job, because they get what's possible and what's not possible and what's going to work, and you get that because you've done it.
Yeah, and I've always had the mindset. I've had some amazing mentors in my career. You know, I remember one of them, she'd be walking down the hallway in her business suit and she would stop and answer call lights. And so as a nurse, and as I've moved away from the bedside roles, I've always remembered that about her. Like, I'm still a nurse at the end of the day, and how am I going to impact those patients and or the staff that are taking care of those patients? It's really important. And one of the things I think that's also very important is to get the input of the staff that's taking care of them. Because if you don't, it's going to fail. Any project you do, if you don't get their buy-in or input and they understand the why, it won't work.
Ashley, we talked to Dr. Matt Danter, cardiothoracic surgeon, about your work as an LVAD coordinator for his patients, and he lit up talking about you.
We rely on them for education. We rely on them for their assessment of patients. And then really, in the outpatient and clinic setting, they're seeing the patients all the time, reevaluating them, doing you know, the multiple touches that it takes to keep people out of hospital. So they're getting phone calls all the time, sometimes at all hours of the day. They know these patients in a way that really, I can speak, at least from my perspective, surgeons don't even know them that in depth. They will not know who necessarily was their surgeon, or sometimes even who their primary cardiologist is, although they see them much more frequently, but they'll sure as heck know who their coordinator is, for sure.
I've actually noticed that. I'll be talking to a patient and say, "Now, who is your surgeon?" And they say, "I don't know, but my LVAD coordinator was XYZ." Oh. They develop such a good, unique bond. How often are you in contact with your patients, each individual patient?
So initially post-op, I mean, a lot. You know, we'll see them weekly for 2 to 3 visits, and then we'll go bi-weekly 2 to 3 visits, see them monthly for the first 6 months, and then they are assigned to one of us, and so they have our desk phone number, and we definitely encourage them to call with any issues, especially since it is so specialized. And
what are they typically asking you about or seeing you about?
So, you know, like if because they still have heart failure, so we encourage them to call, like if they have a weight gain, if their Doppler blood pressure is high, if they're having an issue with the drive line that comes out of their abdomen, any equipment issues, like really we tell them anything, you need to be calling us.
And with a patient calling you for any reason, how many patients do you have at any given time that you are managing with their LVADs?
So right now we follow, I believe it's 127 patients, which is considered high volume.
Right.
Like each patient's assigned to a coordinator. There's 4 of us RN coordinators, but we definitely like work as a team. So we all like help with each other's patients, but we just have like their one go-to, so they're not just like, well, who's here today? Who should I call? And
they know who to ask for.
Yeah.
So 127 patients, and there's 4 LVAD coordinators. So you are hustling. You're busy,
Yes.
and such personal time you're giving to each one.
Yeah, yeah.
We want to talk to Sophia now, and we want to hear what your patients and what the doctor who works with you had to say about you. You work directly with patients involved in clinical trials, so we talked to Dr. Mark Wiley. Dr. Wiley is the Division Chief of Cardiovascular Medicine. He's also the doctor in charge of several clinical trials. This is what Dr. Wiley had to say about Sophia.
Sophia is just an incredible individual. She has so much young energy. She is one of the most caring individuals that I know, and goes out of her way to above and beyond to take care of patients that we see. You know, when you start to talk about research and uncertainty, Sophia brings a level of certainty and calmness and reassurance for patients who are kind of working through the unknown and have a lot of questions. So that really makes a big difference in patient comfort level.
Sounds like you're a life coach as well. Where did you learn that skill in nursing school?
That's a really good question.
Did that always come naturally to you?
I think maybe partly. I think in nursing school they do, you know, touch on like therapeutic communication and
what's
just,
that?
You know, trying to make the patient feel comfortable, and you know, just creating like a safe space for patients to like voice questions or any concerns that they have. And I don't know, I think maybe it does come naturally. Like I feel good when I can assure a patient and make sure that they feel safe and heard, and that they can voice any questions they have. So.
How do you balance the hope with the science of a clinical trial, in that a clinical trial, it's not certain yet which way it's going to go? How do you balance that?
That's also a really good question. I think that, you know, yeah, it is uncertain. We don't know, you know, the results or how some devices or medications will work, but by participating, you know, that's how we learn, taking that leap. And if it doesn't, then at least we have, you know, new information that can guide us towards a different direction. So, yeah.
We already have some great questions coming in. If you have a question or a comment that you'd like us to share on the program live, just send it to us right now on YouTube, Facebook, the All Things Heart email. We have all the links on how you can connect with us in real time right now on your screen. And viewers, as you're seeing over and over, the thing our cardiologists stress when we ask them about the RNs they work with is just how much they rely on your close personal relationships with each patient.
I mean, a lot of times the surgeons get a lot of accolades, and please keep coming with those because we're very fragile people and we basically exist on them. But really the people that make the machine run are the people that take care of the patients afterwards. And during, but afterwards too.
Fragile people. Do you call Dr. Danter fragile? Do you kind of like give it to him? Poke at him?
I'm very lucky. We have a very good close team, and I think that we are able to be very honest with each other when needed. Yeah.
And that's something that the doctors also said, is that they really appreciate the expertise and the viewpoint, because when you're working with a seasoned professional, other viewpoints will come into play if you see something different or you have a different view. This is what Dr. Danter had to say about that.
In an environment where there's differences of opinion sometimes. I think it's important to have relationships with people like Ashley who'll just tell you if you're being stupid, and sometimes I need to be told if I'm being stupid.
Do you ever tell them that? Have you ever actually said that?
No, I've never told.
Not that you'll admit.
No, yeah.
How long does it take you to feel that comfortable? Or did you come into your role feeling comfortable and confident enough to just say, hey, that's not how I want to do it?
No, I've always been pretty outspoken. I think, it's important to, if you're really feeling something, if there's a problem, speak up, because, people can't read your mind, they need to know, but that's not always easy, and I'm not always able to. But I think, once I joined this team and really got comfortable with like my practice and knowing what I'm doing and wanting to have that input, and then, I'm very fortunate that I do get to work with doctors that actually, they want to hear what you have to say, and that they recognize how much we put into the program and the patients. So
the specific knowledge each of you brings. You bring a different knowledge base and a whole different skill set. You've been nodding your head, yes, quite a bit.
True. It's true. Nurses, it's good to hear the comments and the sentiments from the physicians, but I think, I've probably been the nurse longer than either one of these two, maybe longer than you two together, but
isn't that weird? It's weird to see that.
It's good to see the evolution of nursing, and nurses are, if they're concerned about something, speaking up or sharing their viewpoint on something. Have you thought about it this way? Whatever. I think it's fun to see just the evolution, in my career.
Is there a specific trait that you use, or a kind of a skill you'll use regularly, where you think, Diana, I'm so glad I was a bedside nurse for so long, because I know this will work or this won't work? Does that happen?
Yeah, I mean, and, just even I round with Dr. Surface sometimes, just because, our program, we're still growing it so much. So, I like to go to the Gemba, they say, and lean, or to be at the bedside and see what's happening. And
what is for viewers, what is Gemba and what is rounding?
Going to the source, and so going to the source when we see new consults, I'm actually seeing what happens when we see those new consults.
Meeting each patient.
How do you make a process better if you don't actually know what's happening, kind of thing. So I go with him a lot, and just last week we saw a patient, and she's a single ventricle patient, so very acute, and we were talking about something, and I made a suggestion, and Dr. Surface and Taylor, one of our nurse practitioners, looked at me and they're like, oh, that's actually a great idea. So just sometimes saying, have we ever thought about this?
Right.
As kind of the words I use, because I could be right, I could be totally off base, and I think, but sometimes it's nice to suggest that. So
Absolutely.
We're actually going to maybe trial my suggestion that I offered up last week. So
okay, I want to get with you after the show.
Yeah.
Maybe that's another episode.
Maybe.
Now you're hooked. Now I got you now. Sophia, you talked about some of the training. Was there any kind of residency for nurses or a mentor that helped you through those first few years? And then how did you handle that coming straight from school?
Yeah, coming out of nursing school, we did have a nurse residency program that you could be a part of, and that really helped me kind of get like my footing and understanding, how bedside worked. And I had a great preceptor. Before this role, I was in the emergency department and got to learn a lot. Really got to learn from some great people, and now in this role I feel like I learn from all my team members. Every single day there's something new, and everyone's super helpful and open to answering all my questions, so yeah.
We have some questions and comments coming in from our viewers, so I want to get to those. Marie has a great question. Marie asks, and she shares, my niece wants to go into nursing, but she doesn't know what kind of nurse she wants to be. How long did it take each of you to find your specialty, Diana?
So, because I worked in hospitals since I was in high school, I did all through college, I got to experience a lot. So I encourage people who want to go into nursing either to try to get a job even in a hospital earlier as a tech or a CNA. I think that's a great experience. And if not, just while you're in nursing school, really soak in every rotation that you take. And I think you kind of know, innately you know where you belong.
You just felt like you were getting the cardiology piece of it.
Yeah.
Ashley, how long were you a nurse, bedside nurse, before you realized I want to be a specific LVAD coordinator for those patients?
It was about, I think, 4 years, and the program at that time, I believe, was only about 1.5 years old, and I just knew that I wanted to change. And honestly, at that time, it was more I was working nights and I wanted like more of a regular schedule. And that opportunity came up. I was like, well, I do really like, you know, working with these patients. So this would be, I think, interesting to at least try out. And that's the great thing about nursing, you know, if I ended up not loving this job, I could have gone and done something else, but I did. So, you know, almost 8 years later.
8 years later?
Yeah.
Sophia, what about you?
I'm still super early on in my nursing career.
You're the baby
Yes,
of the group.
I am.
So is this your first stop? This is what you did straight out of school?
So this is my second stop, but before that I was also like a nurse's aide and nursing associate. So I did some of that before college, during college. And then was in the emergency department for about a year. And I also really thought this would be a great opportunity to just like learn a different area of nursing. And I've been in this position for 2 years now, and I really, really like it. So
they like you.
Yeah.
So we're very glad that all three of you are happy. Jeremy wrote something very sweet. He wrote, I imagine the emotional resilience of a cardiac nurse would be super important since cardiac patients can be in such life-threatening circumstances. How do you all keep that balance when the people you care for can be in such terrible or precarious situations? Diana, you work with people who've been patients since they were born.
Yeah. I think you have to look at the silver lining. There's a lot of rewards to be seen. And, you know, even if some of these patients are experiencing things that maybe, you know, we're consulting palliative or, you know, having to do other things for them, you know, you help them through the moment they're in. And that's how you always have to look at it. How can I impact this person today? And, you know, and at the end of the day, you see those rewards when you can help them each day.
What about you, Ashley?
I'd say very similar, just seeing my patients going from being so sick to just getting to have a life, have those extra years. And it's just, you know, it's a very rewarding job.
And when you see a patient, like we just had a patient on a few months ago who went through a clinical trial and he says he's doing amazing.
Yeah.
And how do you manage the situation before you know that outcome?
Yeah, I feel like really being able to just provide assurance and trying to help them understand like what they can control in the moment.
Yes.
And just, I think the education piece is also really crucial in, making them feel comfortable that they're taking like the best step for them. So yeah.
And I know I brought up the life coach angle, but it really feels like all three of you and every nurse I speak with have that way of managing stressful situations. It would be comforting in any situation to hear, what can you control right now? How do you manage that? And just face the moment in front of you, which is a skill that you all have, which is such a gift to our patients. As we wrap up this discussion, I would love to get your final thoughts. But first, I want to share some more final thoughts from the doctors we've interviewed for this episode.
We got the best team. I mean, we could not do our job without our nurses. And I go to clinic every day. My nurses, or my patients come to see my nurses more than they come to see me. And honestly, we could not take care of patients like we do without our nursing staff. They're incredible.
I'm just very grateful for everything that you do, Ashley, and please keep it up. Don't change a thing.
But at the end of the day, healthcare is about sitting down with a patient in front of you. And there is no one who does that better than nurses. And that is at the core of everything that we do, whether it's in the hospital, in the clinic, in imaging, pretty much anywhere healthcare is provided, you will find nurses at the forefront and center of what needs to happen. And we could not do it without them.
Such high praise. Diana, what do you want our viewers to know?
I think just know that, you know, especially I'm going to send the message more to people who are considering a profession in nursing. Because I'll be honest, we need nurses. We all know that. And so if you're considering it, I mean, I seriously suggest you, you know, dip your toes in the water. It's a great field. It's a great profession. There's so many things, as you can see from us, that you can do. Not only taking care of patients at the bedside, but you can have a lasting impact even after that.
Ashley, anything you'd like to add to that?
No, but I agree. Like, this is a really great career, and just what you can do. You know, you could do oncology for a while, you can do cardiology, and then once you really find what you like, and then, I mean, you could just do that until you retire, and it's really great. I'm really I'm really happy I'm a nurse.
And as you were saying, Sophia, there's so many different, we have 3 highly specialized nurses on this program. There are thousands and thousands of other directions that your career can go into in nursing. What would you want our viewers to know, Sophia?
Yeah, I definitely agree with everything that's been said. Like, I think nursing is a really great profession, and I feel really grateful to also be like surrounded by all the nurses I work with and like my team, and just want to give like a huge kudos to all the people that, teach me new things every day, and the patients. So
thank you for being nurses, and thank you so much for doing what you do here at the health system. We are so lucky to have all 3 of you. Thank you for watching. If you would like to watch or share any one of our previous episodes of All Things Heart, just scan the QR code that's on your screen right now. That will take you to a list with links of all of our previous episodes. Coming up next week on All Things Heart, we have shown you the life-saving benefits of lipoprotein apheresis for patients like this little girl who was born with dangerously high cholesterol. Now you'll see how the treatment is helping pregnant women and why this mom says it is the reason she has her miracle baby in her arms. That's next Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update. It takes special training and a certain temperament to succeed as an emergency department nurse. I'm Jessica Lovell on the next Morning Medical Update. An inside look at one of healthcare's toughest jobs, Friday at 8.